Hello. Today we're breaking down basic anatomy terminology so you can navigate the human body a little better than the average person and understand better than the average person. So as you can see here on the screen, the first example is basically understanding the normal anatomical position, which usually means standing upright, facing forward, arms outside, and palms facing forward. So this right here is an example of the basic anatomical position. The next part we're going to be speaking on is directional terms. So the first one here is anterior versus posterior. So anterior can also stand for ventral, which means towards the front, so outwards. So for example, the chest is anterior to the spine. The chest is towards the front of the spine. While posterior, also known as dorsal, means towards the back, going away from the center. So an example of that is the spine is posterior to the heart. Our next example is superior versus inferior. So superior means above, to be above, higher than, to be just more up. That's what superior stands for. So an example of that is the head is superior to the shoulders, while inferior means to be below, to be under, to be less. An example of that is the knees are inferior to the hips. Our next example is medial versus lateral. Medial means closer to the midline of the body. And as you can see, the midline of the body is sort of the center, right in the middle, in the center of the body. So the medial means to be going towards, to be closer to that line, to be closer to the line in the middle, the midline. So an example of that is the nose is medial to the ears, while lateral means to be farther from the midline, to be going away from it, or not going away, but to be placed away from it, to be located away from it. So an example of that are the hands are lateral to the chest. Our next example is proximal versus distal. Proximal versus distal is usually used for mostly limbs. Proximal means closer to the body center. So an example of that is the shoulder is proximal to the fingers, while distal means farther from the body center. So an example of that is the toes are distal to the knees. Now for the next section, we're going to be speaking on planes of the body. The sagittal plane. The sagittal plane is the plane that divides the body into left and right halves. Example, a forward lunge happens in the sagittal plane. So I'm going to repeat that. A forward lunge happens in the sagittal plane. While the next type of plane we have is a frontal or a coronal plane. It's called either one. You can call it frontal or coronal. But that divides the body into front and back halves. So an example of this is jumping jacks occur in the frontal plane. And our next plane is the transverse plane. The transverse plane divides the body into the top and bottom halves. So an example of this is twisting movements like Russian twist happen in the transverse plane. These are your planes of the body. Our next section and final section are common and anatomical movements. So the first one is flexion versus extension. So as you can see with this example here, the elbow, the flexion decreases the joint angle. It makes it smaller, makes it acute, less than 45. While the extension increases the joint angle, making it larger. So things like straightening the arm is extension, while things like pulling in your arm is flexion. Well, in our next example of common anatomical movements is abduction versus adduction. Abduction versus adduction. So abduction is to move away from the limb, is to move a limb away from the midline. So lifting your arm from side, bring your arm out to the side, making it more horizontal than vertical. So instead of letting it hang, you put it in and make it sort of your body a T position, a T shape. While adduction is bringing the limbs back in towards the midline. So from bringing a T towards your body. Some way to remember this easily is abduction is, your limbs are getting abducted away. That's just an easy, quick way to remember something like this is your limbs are getting abducted away from the midline. Easier way of remembering something like that. Wow. The next and final common anatomical movement is rotation. So rotation is basically just movement around an axis. So something simple like turning your head or turning your leg in a sort of horizontal movement from left to right. Turning your body like that from left to right is considered a rotation, a movement around the axis. And that's your crash course on anatomy terminology. Now, when you hear terms like proximal, sagittal, or flexion, you should know a better idea of what it means. Thank you for listening.